Dr. Lugi, again, speaking more from the, primary healthcare perspective. And of course, we know there's a growing charge for alternative source of energy. So we're hoping that also could actually help address some of the challenges to power. But we'll go over to Dr. Elebute real quick. If you could share, ma'am, how are you leveraging technology? And more importantly, how are you basically seeing the use of technology to educate, the common man, so to say, loosely the word common man in Nigeria to understand that these resources and these opportunities are now in country for better and improved, healthcare service delivery. Dr. Lupte. Yeah, okay. So, yeah, there we go. You should be able to unmute yourself now, man.
Thank you. Thank you very much. So I think, just thinking about it, I might take this from a slightly different angle, just in case I don't have another opportunity to speak, because I can also see some of the comments in the chat box, which is to say that for your audience, like Dr. Shini was trying to address as well, and because I'm somewhere where there's a group from medical school celebrating a 50th, and the same questions all the time for those who remain in the diaspora. It is doable to come and work in Nigeria. It is. There's a lot of work to be done. There's a lot that you can do. And you don't necessarily have to do it by coming back totally, which I think there are one or two people on this platform are thinking of doing. And that's where the technology comes in. So for example, we have a tumor board every Thursday from 4 o'clock to 6 p.m., which is where we discuss every single new cancer patient that's come in the last week or so, just like we would be doing if I was working in the UK. And we're able to do it because we use, well, it used to be Zoom, but it's one of the other platforms now. Our radiology is reported in the UK. So the radiologist is on, histopathologist is on. We have 6 oncologists who join us every week. I'm extremely grateful to them because they won't take a penny from us. Most of them I'd never met before in my life until about a year ago. Most of them contacted me by LinkedIn to say, we gather you're mad enough to go back and work in Nigeria. How can we help? And I said to everybody, we need your intellectual property to ensure that we're doing things the right way, that whilst we're staying in Nigeria from time to time and without the colleagues that we would normally have around us if we were in the UK or the US, that we remain current and ahead of our game, and that we're providing patients with care. So that's where we use technology. It's made a huge difference. We have 3 colleagues from the UK, 2 from the US, 1 from Toronto, who join us every Thursday. We've been doing this since 2021. People told me it would never last. We're doing our tumor board every week with the surgeons, urologists, our own oncologists, and so on. It's been a fantastic way of using technology. The patients are aware that we're doing this and that they trust that what we're doing is correct. Because one of the big issues with medicine in Nigeria is not far from the costs, is the trust. People don't trust that they're going to get the right diagnosis. They don't trust that they're going to get the right treatment. So even when you tell them, and we've gone through this process, they spend half their time still finding doctors in the US, in the UK, and so on. So messages to those listening today, this is doable. There is regulation. There are regulators in Nigeria. We brought back a state-of-the-art true beam radiotherapy machine to Nigeria, which is one of 10 machines in the country. We brought it back under regulation, but we did it totally, everything we've done, I will also say openly here, we didn't pay anybody any bribe to do anything. Nigeria has the regulation. It had throughout the whole practice and so on. But working with the regulators, I mean, they were so delighted that we were going to be doing what we're doing because they know that there is a paucity of access to care. And so they were extremely happy and we worked together. Obviously, we use a technology, EMR, for our patients. And because we're developing a research portfolio, because in oncology, one of the biggest issues is that lack of data from the African population. So we've got an ethics committee. We're regulated by the National Health Ethics Committee. We've got an ethics committee that's 11 strong. We are now collecting blood and saliva samples from our patients with informed consent. And we're now going to be part of a number of clinical trials, as well as population studies, genomic population studies with groups internationally. That is where you can put yourself. And yes, we're one end of the spectrum, but that end of the spectrum has to be in healthcare. They're the Mayos and the Clevelands and so on in the US. They're also the people in the healthcare sectors in the US that are the public sector based, where people can't really access much care because they don't have health insurance. It happens everywhere in the world. But where the diaspora can work and really have trust is that things work in Nigeria. Okay, it may not be straightforward. It works better, of course, in the private sector because we have access to where we can, and it's not easy, the finance and so on to make sure that the infrastructure is in place, but also because we have colleagues that we can collaborate with and work with to make sure that we're doing the right thing. So I want to just say to everyone, it is possible to do this. And even if you cannot come back to live, I know some people are coming for a year or whatever, collaborate with those of us who are there. Most of us have space in our infrastructure. The Duchess International has 100, I think, beautiful private sector beds. It's got theaters, it's got a cath lab, and so on. You don't have to come and reinvent the wheel. You don't have to come and build your own. You can come and set up your own practice within the Duchess. I am Dr. XYZ at Marcel Ruth, and we will support you because we know we need the support, we need the help. We know our patients need that support and the help. And the better that we get, we're going to be able to support the public sector better, which is why I do a lot of work with the public sector across the National Medical Association, Medical Women's Guild, and so on. And it's why I, at the end of January this year, together with 15 other incredible women in the healthcare sector, we launched the Women in Healthcare initiative, which is open, please, to all the women in healthcare in the diaspora. So please do join us. We're doing incredible things. We're doing leadership programs. We're doing mentorship workshops. We're going to sort up internships. And so the ones who are abroad can help us with that. There's so much that we can do, but with a strong private sector workforce, which is also showing the government that where there's the money, which is what Dr. Oshini was referring to, and Dr. Ogumbi and so on, that things can be better. And so I think that's where we're playing our own game. And obviously we're leveraging, we do, even our chemotherapy, we're now doing e-prescribing. Our radiotherapy is totally technology driven. We try not to do any writing because in our sector, we're very worried about errors in terms of treatment and so on. So everything is done electronically where we can, but also we're using the technology as our base for our software to collect this data that is so needed. It's been a lot of work, and I'm very thankful to our R&D lead. It's something we don't have to do in private practice, but because we understand that this needs to be done and that Nigeria has the opportunity to contribute to these population-based cancer registries, we're taking the lead together with the National Institute of Cancer Research and Treatment that Dr. Tunji Alausa has just, and Professor Pate, the Ministers of Health have just put into place. And we're all collaborating across private sector and public sector. And that's the way to go. But for the people on this platform, there's work to be done. Nigeria is never going to be easy, whichever way we look at it. But by doing what we can, either by coming back or even if you can't, I mean, I turned 62 weeks ago. I came back after most of my children are educated, so I can understand that. But you can come back and work with people who are already there. We need your help, and we can also support you to make it easier. The finances, I think, has been discussed at length. I'm just saying, there's also the commitment and the will and bringing back this intellectual property that is huge on this platform to come and help us make things better, both in delivering the clinical care, but also in doing the teaching and the research that needs to be done in Nigeria. Thank you.
Thank you so much, Dr. Elebute. And again, this is the reason why we're hosting this webinar. We cut across different sectors. Today is the healthcare sector, and I'm very excited and glad that, our panelists are actually collaborating what the vision of NAPAC CDI is, which is going to leverage the expertise of the diasporan community to impact our home country and, of course, the continent at large. We all are already used to this common phrase out there. If Nigeria can get itself together, the entire continent will get itself together. And that's just a fact because of population, because of our skill set, and more importantly, because of the level of our diasporan influence across the entire world. So I do appreciate all that you've just shared and re-echoed and emphasized that the opportunities are there. And we don't need to really reinvent the wheel. This is why we are trying to be that bridge, and we are building that bridge of trust, of opportunities, of accountability, of leverage, okay, for most of our diasporans who wants to go back home, because the reality of those challenges is still there. But that's only when you are willing to compromise and you're also not speaking to the right, partners on ground. So I'm glad that, Dr. Elebute actually emphasized on that.